when you look at the wall of shame, it's still not highly sophisticated attacks by foreign actors. It's good, hardworking, frontline people, business people, those kind of people who make a simple mistake.
This is a Security Weekly production. Security Weekly is a resource of Cyber Risk Alliance.
The Cybersecurity Collaborative, in conjunction with Cyber Reason, is proud to present CISO Stories. Each week, CISO Stories takes a deep dive on security leadership. The Cybersecurity Collaborative is a unique membership community enabling cybersecurity leaders to work together in a trusted environment. To learn more, visit securityweekly.com/CSC. I am your host, Todd Fitzgerald, and this week we welcome Bill Miaoulis, CISO at Auburn University.
Well, I was doing computers before computers were known, and started with the thing called EDP auditors, and I went from auditing into my first cybersecurity job at UAB Health Systems, and was there for about 7 years. And at that time, it was, being a healthcare cybersecurity professional was very new. There was only a few of us in the countries. And the biggest reason they wanted to do it was they were opening their own healthcare insurance product. And when they talked to the employees, they said, "We don't trust the data is going to be secure. We're going to go somewhere else. So, we don't want to be tied to UAB." And so they wanted to ensure, so they actually had a security committee, and the security committee's first role was really to get a job description and hire information security officer. So I was at UAB back a long time ago, 1993. So it goes back that far. So 27 years.
Wow, so you've seen a lot of changes in this industry over the time, haven't you?
I mean, there's just no question about it. When we first started, and then even when we did, I left there after 7 years, and because of HIPAA, got into consulting. And, I can remember talking to physicians saying, "I will never use a password, but I don't have time. When I walk up, I want to hit a button and see my patients. This is life-threatening," And so, that's just one of them. And then, you see other things where, again, having done consulting for 14 years after I left UAB, you would see things like someone would say, "Hey, explain to me how you add people into the system, grant the roles, et cetera, et cetera." And they go, "Okay, here we go. Here's how we do it." And I says, "Well, now tell me how you take people out of the system." Okay, this is 25 years ago. So we compare today, and it's a little comical, or 20-something years ago, and they go, "Why would you want to take someone out? They may come back and work for us." Some of these things that, in the pre-HIPAA days, security was that way. And I'm going to tell one other story. I've been married, be 25 years in June. And
congratulations.
Yeah. So when my wife would ask me what I did, I tried to explain cybersecurity to her. Of course, I called it information security. And I tried to explain to her what it was. And, just really couldn't do it 25 years ago. No one knew what an information security officer was. And so finally, I just said I work with computers. And if I did that with most people, then the next question they always ask is just, "Can you fix my printer for me?" Right? So that's a little bit of the age of it. And so, we've seen controls grow. And, we've seen things grow, but a lot of the fundamentals are still there. I mean, the same fundamentals that were there 25, 26, 27 years ago. How do you grant access? How do you protect data are still there. So,
and it's very interesting to me. Always fascinating that these controls, the fundamentals are still there, but we still have breach after breach after breach, and a lot of times it just comes back to those lack of fundamentals.
It is, and some of the concerns. Again, I kind of go to my topic a little bit because it's, do you really know where your data is? And especially now that we're in a COVID environment, we have people working from home. You may have people working on their personal computers. Or are they storing that data on personal devices that might be unencrypted? Or are they storing those devices on flash drives that are still in? So I'd like to talk a little bit about the topic that I brought up in the book, which is, do you really know where your data is? Because one of the things you have to know before you can secure data, you have to know where the data is. And especially in these days with COVID, we have people that are storing files maybe on their home computers, maybe on their personal flash drives, things we tried to prevent long ago in healthcare by not allowing personal devices and doing those type things, but are coming back, in the realm of healthcare. It's a little easier in healthcare, so some of it, is industry, but are people downloading things to spreadsheets still, attaching to a Gmail, sending them to their home computer? They're doing it to save time and effort. We're doing data analysis. We're doing research. Where does that data go? And so the very first thing that I always feel people have to do, and, we talked about data flows. Where is the data? Controls follow the data. So if you don't know you have something, you can't protect it. So if you don't know that that data is residing in a cloud storage solution, which we've seen breaches along that line, then you don't know to protect it. You don't know it's there. You don't know to put the controls on it. So again, there's that. If someone downloads that information, I remember some old ones where people would take, again, information home. Their kids would use the same computer, and they would say, hey, look what we're able to see on mom's computer. Or the kid that takes a flash drive that has data. Today, there's really no excuse not to have password-protected, encrypted flash drives. But we still see breaches about unencrypted flash drives.
Yeah, absolutely. And that's one thing I really liked about your piece for the CISO Compass book. Do you know where your data is? Because it really seems to start there, right? Is that knowledge of where that information resides.
Yeah, once we decide where the information is, again, you can design controls. But if you do risk analysis, you can't do a risk analysis of something you don't know. One analogy I used to use was, hey, Todd, if you knew you had $100,000 in your backyard, you'd go out there and protect it. If you don't know there's $100,000 down in your backyard, someone else may come along and get it. So you didn't know to put controls around that money that was in your yard. And you might say, hey, I'm going to bring it in the house and put it in my safe. I'm going to take it to the bank, but I'm going to implement controls around it because I now know I have an asset. And the data is an asset. And what we're trying to protect is that patient data, that patient social security numbers, that patient diagnosis. All that type information is very critical information. But again, if you don't know where it is, you can't protect it.
Do you think that people are just careless, or do they not know that information has value that they're working with every day?
I think people are now starting to get the message that it's valuable, but I think what they sometimes don't understand is that it's always, well, I'm not going to do anything wrong with the data. I'm not going to do anything. So let me put all this data in Box as an example, or Dropbox, or a cloud storage device, and I'll handle the controls. And you have to have that ownership of the data. That asset belongs to the institution. Whether you're talking about a university or healthcare data, even now I've been at Auburn 4 years, and I'll still use healthcare examples, of course. We do have a healthcare component. We have a retail pharmacy. We have speech and hearing clinics. We have wellness centers. I mean, there are things we have from a HIPAA component, but it's not like being, a major healthcare organization, but we still have to follow the same controls. And so when we do risk analysis there, the very first thing is identify where your data is. And then I start asking questions. Well, can I, as a user, attach this to not trying to pick on Gmail, I'm a Gmail user, Mail, Yahoo Mail, Hotmail, Outlook Mail. I can monitor all those that use the Auburn system. Whereas if you send something using the Auburn email system, we have a product that will say, oh, you're trying to send information out that we quarantine. But now you have systems outside my control, again, whether it's a flash drive, whether it's an external method to get that data away from Auburn. So you try to do that with policies and procedures and education and training and awareness. But going back to my example of when I first got married, my wife didn't know what I did. Now everyone's a cybersecurity expert, and so it's not the hard sell of, not needing passwords. 4 or 5 years ago, two-factor authentication was difficult to implement in some ways. Now I wouldn't go to banking. I wouldn't deal with a lot of companies that don't have two-factor authentication. It's not perfect, but it's 99% effective. You've reduced that scope down. So then when you take that data and put it somewhere that's not protected by two-factor, where a simple click can share it, or you absolutely attach a file and send it to the wrong person, or it goes back. If you send a file to the wrong person, you then have to follow the process to see if that's a reportable incident. Now, if it's someone that, another healthcare organization, there are ways you can get around that. But again, if that gets published. But again, I think that, when you look at the wall of shame, it's still not highly sophisticated attacks by foreign actors. It's good, hardworking, frontline people, business people, those kind of people who make a simple mistake. Again, they put it on an unencrypted flash drive, lose the flash drive.
So do you secure those flash drives, or do you block the ability to write to flash drives, or how do you manage?
We can do that in such a hybrid environment that we're in. We can do that within the healthcare components. But as you know, that can be difficult. We were doing it. I was an interim CISO in Louisiana for a while, and we absolutely implemented that you could not stick a flash drive in unless it's an approved flash drive. Again, people say, what do you mean I can't check my Gmail on my hardened desktop? So yeah, once you know where the data or how the data can leave your organization, you can design the controls. The technical controls are out there. My 1,000 vendors that call me every day. Go ahead.
Yeah, so varied success, I guess, with blocking USB drives, or work some places, doesn't work other places.
It's all based upon the risk within the organization, and again, in a healthcare environment, it's pretty safe. All your data has to be protected almost. At Auburn, we do classify data based on special needs, and so there's areas of like public data, operational data. We get into sensitive data, and then we also have a special case for both highly sensitive research, which many healthcare organizations have research, and then also healthcare information is another one. In those areas, we try to implement controls down, very, very role-based controls within specific areas. And so, again, it's easier to make the case in the healthcare environment because HIPAA tells us we have to, and we can see the fine penalties. And really, there was still some educational that I think goes on. And I think it's very difficult for the small doctor's offices to do this, or the small practices.
The article this podcast is based upon can be viewed in the best-selling cybersecurity leadership book, CISO Compass, Navigating Cybersecurity Leadership Challenges with Insights from Pioneers, available at Amazon.com and other booksellers. So when you put in things like, I know you mentioned that using things like DLP to capture things going outside, when you turn that on, do you usually see, oh my God, all these things are going out of the organization that we were unaware of?
We actually did not. We have found some. Oftentimes, it's someone using their Auburn email account because some of these professors have been there a long time and they're sending their own tax records through. And they go, well, why can't I? It's my data. Well, because I don't know that, and I have to react to the way the DLP system works. Mm-hmm. So that's just one example of an academic environment, different from what we would have in a healthcare environment. You would just, you would block it a little bit easier. So you see that. Interestingly, I'll give one example. We had someone send us a spreadsheet, and when it was completed and sent back by a particular department, we discovered all these socials and grabbed it. And so when we were looking at the spreadsheet, we found out that they had not a hidden column, but a hidden table. And so the person who sent it from our end didn't even know they had gotten it because it was a hidden table. And we're like, the product's not working. Something's weird. And so, again, so that was more someone on our end not knowing. We then got with the vendor and said, hey, did you know you did this? And if you looked at the spreadsheet, you wouldn't recognize that it actually had, information that should be blocked. So
Interesting. Yeah. So I mean, and then just the maintenance of a DLP solution takes some manpower, doesn't it?
It does take some manpower, and compared to some organizations, I do have a staff of 8, counting myself, employ a couple of students, but it's not just DLP and email. It's DLP again in our storage solution. So we have DLP turned on in our cloud storage solution, but we can quarantine and take appropriate actions. But again, if you are using one cloud storage vendor and then someone else goes out and begins using another that we can't test for, people can go out and purchase storage on their own. Mm-hmm. And again, you always worry about that data. There's no matter how many things you try to control, there tends to be a way for some data to slip through, and trying to do it at again, not so much healthcare. I think you have a better chance, but we all know, and again, it's been 5 years since I've been in healthcare. There's still ways that people can do that, unless you block all their internet access and and at different levels that may or may not. A lot of times we have to do data collaboration and research. I'll get into the research component. How do I share data from one healthcare organization with another healthcare organization? A lot of times we do that with like cloud storage. What are the controls over that cloud storage? Do you have two-factor turned on? I am a big fan of two-factor authentication. I think that has really helped us as an industry, because we all know how bad passwords are.
They get
hacked so easily. Yeah.
Yeah, and so you mentioned that you've moved into the cloud. Is that been a recent thing, or is healthcare more comfortable now with putting things on cloud platforms?
We have very little in the healthcare cloud. We do have what we call a HIPAA account in the cloud, and so that has additional controls that we monitor and watch as far as who can grant access. So you have to really treat it like that. And so if we find, again, our DLP would look for healthcare information, looks for socials, looks for driver's license, passport numbers. I still think that whole product suite, the whole CASB, Cloud Access Security Brokers, are maturing. We may, see what's happening in that industry. We've had that going for over 3 years. So we know it's been successful. But again, typically, when people learn it, then we find other ways. We have to provide a secure way for them to share that information. So again, in one area we do allow it, but we really watch, your access reviews, who has access to the data, the audit trail when someone's granted access to a particular photo, all those type of things that you would do. It's a little bit easier in the cloud in some ways, but again, typically it's when, you have to collaborate with, or multiple people need it. And, but it has been successful, and it's more of an outreach type thing for us than a research thing at this point.
So how do you make sure you mentioned that you provide secure locations for, employees to put their data, which I think is a great idea. How do you make sure that those platforms are secure?
Okay, there's multiple things. One is we have secure enclaves. Okay, so one of the things you do is you have to have a vulnerability management program. Are the machines being patched? Let's just start off with examples. Are the machines being patched? Are there known exposures that are happening on your operating system at your server? We don't want data on an unsecure, server. So, that's one way that, there's multiple products out there that do vulnerability, look for vulnerabilities. Again, 25 years ago, nobody looked, but now, we do that. So that's one thing. We try to tell people not to store this information, even on the Auburn desktops and laptops, although we encrypt all desktops and laptops in those critical areas now, all HR, healthcare, all that type of research. All those, either whether it's a desktop or a laptop, are encrypted, and again have additional controls. And we continue to enhance the controls. But even so, there's people that have, information that's, more secure. So we do vulnerability programs. We monitor that. We report that based upon service and college to various people, and we trend, are you improving or not? There's no such thing as a fully patched 100% secure machine for longer than probably a day. So what people are trying to do is, is it in the wild yet? A lot of times these vendors, there's two major ones that I know of. I won't mention names, but so I don't endorse either one. But they will, you have to know how bad are your servers or how good are your servers. You can come up with hardware configuration standards, for your servers, for your desktops. But again, some of these, I joked earlier that some of the controls aren't that much different, but they have enhanced us. The tools have helped us. We have, so those are a couple, like you say.
Okay, good. So what other tips do you think we should have for helping the environment to make sure some of these things happen? Because I know you painted a lot of examples of, the end users and, emailing a spreadsheet somewhere or falling for a phishing attack. And how do we get our arms around this? If you could wave your wand, to make, to really minimize the loss that we would incur from these things.
Yeah, I mean, I think, I think virtualization is still a tool that might help us in the long term, whereby they don't have a desktop at a particular station. It's all maintained in a secure location, and you don't have the ability to move that data out of that location, whether it's a report or whatever. So it's all contained. I know where the data is. I can secure it. Trust me, if you know where the data is, you can secure it. But the problem is that there's so many places. In a university setting, and I'll talk about us, even though it's not healthcare, but similar to many hospitals sometimes, we have probably 20 entities that have their own IT department. We have a central IT that provides core services like email, and we provide the endpoint protection. But then each unit has an IT department and might have servers. And so we do this for across all 20. And again, so the magic wand to me, the biggest control I think anyone, if they haven't implemented two-factor, continue to implement two-factor authentication. If you have an 8-character password, that's easily hacked. If you have passwords that you may have used at other sites that then get breached, they can use that at your institution. So the more you can use, two-factor authentication, I think the better off, you'll be. I understand in an academic environment that can be challenging, but again, sometimes it might be that token is good for the day, as an example, on that machine. So if I go to another machine and try to log in as, Bill, that doesn't work. So especially in our environment, if I give you my pay, it's kind of like the guy used to give out his social security number and say, okay, you can't steal my identity. So by putting two-factor, you minimize the exposure. I mean, there's still a couple of ways around implementation of two-factor, but again, you've taken it from, if I have your username and passcode from I can 100% get in as you, down to, maybe I can get into you. So things like if you don't have two-factor authentication on your remote access from anywhere in the world, that's a problem because, people are pounding you. And if you don't know that people are trying to, you're not watching your denies and those type things. So again, I think the number one biggest thing for us, and it's not an easy implementation. It takes some people getting used to, but especially for remote access, you need to have two-factor authentication. You'll have people that says, I don't want to use my personal phone to two-factor authentication. So you have to get them a token or some other means. Well, we can do a callback. There's people that don't have phones. We'll call you back at a landline. And, we even have people that work in, facilities. They really don't touch a computer. The only time they need to touch a computer is if they have to change like their deposit information. Well, there's been a lot of scams in the past about people getting your credentials, change your ACH information, and all of a sudden you're not getting paid. So everybody understood the need for two-factor there. That was one of our big successes. but they were
you
still
make it personal. They really resonate with that, don't they?
Yeah, it resonates, especially when they read that it was going on across other educational institutions. So that was good. Two-factor has to me been the thing that has tightened up security for us more than anything else that I can personally remember.
Well, Bill, it's really been a pleasure to talk to you again, and thanks much for your contribution to the CISO Compass book. Really appreciate it, and sharing your knowledge and wisdom that you've acquired over the years. So thank you very much.
Well, thank you. Hey, it's always a pleasure to talk to you, Todd.
Thank you.
Cybereason is the champion for today's defenders, providing an endpoint security platform to prevent, detect, and respond to malicious operations on computers, mobile devices, servers, and the cloud. Cybereason. End cyber attacks from endpoints to the enterprise to everywhere. Learn more at cybereason.com/CISO stories.